Can you tell?
Can you tell?
Can you tell?
Can you tell?
Human immunodeficiency virus attacks the body's immune system, especially those that help fight off viruses, and if left untreated can lead to AIDS. Acquired immunodeficiency syndrome, the final stage of the HIV infection, is where individuals become vulnerable to opportunistic infections. HIV/AIDS attacks individuals' CD4 cells that can help the immune system fight off infectious disease. Most people transmit HIV/AIDS through sexual behaviors and syringe use. Bodily fluids need to be transmitted into the mucous membrane or damaged tissue or be directly injected into your bloodstream for transmission to occur. HIV/AIDS can also be transmitted through birth in 3 different ways: pregnancy, breastfeeding, and during vaginal childbirth. Transmission through pregnancy can be avoided through medical dosages of antiretroviral therapy as well as through cesarean section delivery. Around 90% of mothers in Canada who are HIV positive received antiretroviral drugs before giving birth. Symptoms for HIV/AIDS can be delayed 2 to 4 weeks after transmission. Symptoms of HIV/AIDS are as follows: fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes.
There is a lot of stigma and fear surrounding HIV/AIDS because of the lack of knowledge of the disease. Historically, HIV/AIDS was referred to as the 4-H disease due to its former 4 root causes: Haitians, homosexuals, hemophiliacs, and heroin users. Although research has improved, social stigma and discrimination remain a major societal issue today. The main forms of stigma and discrimination include governmental, healthcare, and employment. Governmental stigma includes discriminatory laws, rules, and policies regarding HIV. This can alienate and exclude persons living with HIV, ultimately reinforcing the stigma surrounding the disease. For example, in 2015, 75 countries worldwide listed homosexuality as a crime. Not only does this create stereotypes, but also creates barriers to effective prevention, treatment, care, and support. Healthcare stigma. Often healthcare is not confidential and contains judgment about a person's HIV status, behavior, sexual orientation, or gender identity. Stigma surrounding the disease is a main cause of why people do not get tested. Hesitation to get tested means more people are diagnosed late when the virus may have already progressed to AIDS. This increases the likelihood of transmission of the disease, makes treatment less effective, and contributes to higher rates of AIDS-related deaths. Employment stigma. People living with HIV may suffer stigma and discrimination from coworkers and employers. Many people with an HIV-positive status are less productive at work and are more likely to be denied job opportunities. In order to reduce the stigma and discrimination surrounding HIV/AIDS, it is important to become knowledgeable and educated on the disease. HIV is believed to be originated from a type of chimpanzee in Central Africa. There is a chimpanzee version of this virus, simian immunodeficiency virus, and was transmitted to humans when individuals hunted them for meat. HIV/AIDS virus has been in the United States since at least mid to late 1970s. The first diagnosis was in 1981, where 5 young, healthy gay men in Los Angeles reported having a rare lung infection. By the end of 1981, there was 270 reported cases of severe immune deficiency among gay men.
Today, HIV and AIDS has developed into a priority for medical individuals looking to solve. It is estimated that 36.9 million individuals were living with HIV and AIDS worldwide at the end of 2014. Additionally, 2 million individuals worldwide became newly infected at this time. HIV and AIDS is also prevalent in North America, as 1.3 million people have been infected and approximately $4 billion have been spent since 1981. However, not all countries have the availability of medical awareness and practices, and as a result, lack of available sex protection, condoms, and lack of medical infrastructure and treatment in second and third world countries has led to a spread of the disease. Due to the lack of medical infrastructure in second and third world countries, this has led to a serious issue. Individuals living with STIs or sexually transmitted infections such as syphilis and herpes have an increased risk of contracting HIV and AIDS. Not only does medical awareness reduce the potential spread for HIV and AIDS virus, but the protection that is brought on by our police forces and agencies who fight human trafficking assist in the reduction of HIV and AIDS. Human trafficking and sexual assaults are leading causes of the spread of HIV and AIDS. Women forced into the sex trade are often approached by clientele who will pay more for unprotected sex rather than protected sex with a condom, which leads to clientele that are often spreading the virus. With human trafficking being so prevalent in the second and third world countries, it is only assisting in the spread of HIV and AIDS.
Thankfully, though, there are viable solutions to the HIV/AIDS problem. Macro solutions include preventative strategies such as having HIV/AIDS screening offered in developing countries, institutional strategies such as the HIV vaccine being developed by Dr. Chil-Yong Kang here at Western University, and educative strategies such as informing and educating people on how HIV is spread, how to avoid contracting it, and how to avoid transmitting it. Micro solutions include preventative strategies such as the studies being conducted in Southern and East Africa, which has shown that a male circumcision can reduce the risk of a male contracting HIV. Better sex protection is another solution. In Australia, they've approved a new product called Vivigel. It kills the HIV virus on contact during sexual intercourse. Another solution is better availability of drugs, such as PrEP, pre-exposure prophylaxis, a drug used when people at very high risk for HIV take HIV medications daily to lower their chance of infection. Throughout this video, hundreds of individuals have passed by. Can you identify which of them is living with HIV/AIDS?
Can you tell?
Can you tell?
Can you tell?
Can you tell?